Hello, everyone. Thank you so much, Amy. And thank you so much to PSBC for inviting me today to do a webinar series for you all about medications. So yes, my name is Amy Tran. I'm a community pharmacist on Vancouver Island. And today I will be presenting to you all about levodopa. So to start off with levodopa, there we go. So why a whole presentation on levodopa? The reason for this is levodopa is the most effective medication for treating the motor symptoms of Parkinson's disease. There are other classes as well that can help treat the motor symptoms, but this one is the most effective. Eventually, all patients with Parkinson's will add levodopa to their medication regimen. So for some individuals, they are started on levodopa, but for some other individuals, they won't be adding levodopa to their regimen until later in the disease. And I think an important thing with levodopa too is our response to levodopa changes as Parkinson's progresses. So it's just really important to know how it works and the best way to take it just to ensure that you get the most out of your levodopa therapy. So I will show you what I mean as we go through the presentation. So levodopa is the gold standard. Like I said in the previous slide, it is the most effective medication to treat the motor symptoms of Parkinson's. So often people find that levodopa is really good for, the bradykinesia, the slow movement. So it will help, getting ready in the morning, changing, bathing, eating. They just, doing the errands and the things that you need to do for your day-to-day. They will find that levodopa helps with that. It will help in the rigidity and the stiffness that you may feel as well. The one thing, though, that people will find levodopa may or may not help is the tremor. Tremor and the freezing of gait, those are the more resistant, kind of medication resistant symptoms. So some people will find that, even when they do possibly try to increase their levodopa to help manage the tremor, they won't experience any improvement at all. And in cases where people try to increase their levodopa dose to treat that symptom, they find that they might get more dyskinesias or side effects. So it's one of those things that I often tell patients, you have to talk to, your neurologist about it if it's getting to the point where your tremor might be debilitating or just really affecting your quality of life. But I think the main concept is you have to look at your levodopa and see, does it help me does it help me with changing? Does it help me with, getting ready in the morning? Does it help me prepare dinner? If it's helping the symptoms that might be, just affecting your everyday tasks, you really kind of want to target on that. I know, though, that of course with the tremor, it can be quite the nuisance, right? But as long as it's not debilitating, it's just one of those things that, you just have to monitor and just keep in touch with your neurologist about. The other thing with levodopa is that it won't really help with the postural instability, so any balance problems. Often the best thing for that, of course, is exercise, right? So I know PSBC, a lot of the exercise programs for some people in the community as well, they're going to, boxing, they're swimming, they're bike riding, they're doing yoga, Tai Chi. So exercise is definitely more of the thing that helps with the balance problems, whereas the medications really help with allowing you to continually moving and allow you to make sure that you're getting the most out of your exercise because you're fully on and you fully can engage in those activities. So levodopa, mechanism of action of levodopa is essentially, it is converted from levodopa to dopamine and stored in the neurons of the brain. So essentially it just helps replenish the depleted dopamine that occurs due to, Parkinson's. Levodopa is combined with carbidopa or bensericide. So that's why when you go to the pharmacy and you see on the prescription label, it'll say levocarb. So levo for the levodopa and the carb for the carbidopa. Essentially the role of carbidopa or bensericide is it helps prevent the conversion of levodopa to dopamine in the periphery. So before it reaches the brain, you don't want it to be broken down, because what happens when it gets broken down before it reaches the brain is you can get side effects like nausea and vomiting. And of course, with carbidopa helping preventing that conversion, it helps more of the levodopa. So more of that levodopa tablet, you get more of it to the brain to help manage your symptoms. Some examples of levodopa combinations, of course, the Cinnamate, the immediate release formulation, as well as the controlled release. And then we have the Prolopa, which is the bensericide combination. We also have levodopa, carbidopa, and entacapone, which is the Stalevo. And of course, entacapone, I'm going to be covering in the next webinar, webinar number 2. And then we have the levodopa, carbidopa, intestinal gel, so Duodopa. So the onset of action of levodopa. So essentially, onset of action means how long it takes for it to start working. With the immediate release formulation, after talking to a lot of individuals, they tell me around 30 minutes is when it should start working. Whereas with the controlled release formulation, it may take about 1 to 2 hours. And so there is a little bit of a range. With that being said, the experience with carbidopa, like especially the controlled release formulation, it depends from individual person, from person to person, because as Parkinson's disease progresses, essentially there's changes in your gut motility, which can change the way your body, how fast your body can absorb medication. For some people, they do really well on a controlled release formulation, but with the controlled release formulation for some, they might find that the absorption is a little bit more erratic, because the difference is with an immediate release formulation, when you take a tablet, your body can use 100% of that dose. Whereas with a controlled release formulation, it has to almost, with the gut motility, with how fast our gastrointestinal tract is moving, it affects the way we absorb our medication. So that's what it means with the absorption being erratic. You're not getting kind of that steady curve, that nice smooth distribution anymore. The gastric motility or our gut motility can change those effects, and it can affect how we absorb. And that pretty much ties into, it really does depend on the individual. So that's why some people find that they do really well with a controlled release, and some people find that just with the response it's a little bit more erratic and they have to be on the immediate release formulation. So some counseling points. With the immediate release, generally my recommendation is try making it the first thing that you take in the morning. So that's before you get up to, brush your teeth, prepare breakfast, bathe for the day. Have it maybe just like next to your bed with a small glass of water. Make it the first thing, because with what I just said about the onset time being about 30 minutes or so, you want to see if you can take your tablet and then, get up, brush your teeth, brush your hair, change into the clothes that you're going to be wearing for the day. Hopefully by the time you get to, into the kitchen and preparing breakfast, you're already starting to feel on and ready to go. So on in the sense that your medications have kicked in. And then hopefully things like that, by then it's been 30 minutes. So you have that spacing in between. So you have time as well to prepare your breakfast, so that by the time you're eating, you have let the levodopa kick in. And in the note of use as needed, with the immediate release formulation, because we know that when we take a tablet, our body can use all of that levodopa dose. We know that it kicks in fast. It's definitely one of those medications where, for patients that come to me and tell me that, they're waking up in the middle of the night and, it's taking a little bit longer for them to fall back asleep, I usually recommend, don't reach for your controlled release tablet, reach for your immediate release tablet. And if you can, just chew it and take it with a carbonated beverage to help speed up the onset of action so you can get back to sleep sooner. Because if you are taking a controlled release tablet at night, in the middle of the night, and with its absorption being a little bit more erratic, it might take a while for it to kick in and for you to actually get back to sleep. And of course, you want to get back to sleep as soon as you can. In cases where, though, people are, using that immediate release tablet, of course, you just want to communicate that with your neurologist the next time you go in, just to be like, I'm experiencing more nighttime symptoms, just so that they know where you are and how you're doing with your Parkinson's. And then with the controlled release, like I said, some people do well on this medication. Often I see that it is the medication that you use at bedtime. So that's the medication that you use just to help manage you through the night all the way until the morning. Because sometimes, if you're waking up in the middle of the night and you're finding that it's hard to, reposition, adjust your sheets, adjust your pillows, or even adjust your positioning, something like a controlled release tablet might help you through the night so you don't wake up due to difficulty adjusting. So that's when I would see a controlled release tablet. So how to take levodopa. Levodopa is best absorbed on an empty stomach, and why is because it helps increase the absorption. I put that you should take levodopa about 30 to 60 minutes before meals and 1 to 2 hours after meals. I highlighted the 30 and the 1 because I've seen there's different sources that say maybe you should take it 30 to 60 minutes before meals or 60 minutes before meals and then 2 hours after meals. But with there being a range, and for some people they can't really wait an hour because after breakfast they have things to do, they have people to see. I think 30 minutes before meals is fine, and if you can, just 1 after meals. A little bit longer too, that's fine too. So it's just whatever is easiest for you. The main thing though is that if you are taking levodopa, in addition to taking it on an empty stomach, you want to make sure that you space it from iron, because what can happen is iron can actually bind to levodopa and it can decrease the amount that your body can absorb and use from your levodopa dose. So usually I tell people with just this type of supplementation, just if you can space 2 to 3 hours before or after. If a little bit longer and you can do 4, that's excellent too. You might have also seen that with levodopa there's a lot of counseling about just avoiding it and spacing it from protein, because what can happen there is protein can block levodopa absorption, decreasing its effectiveness. And what it means by that is because levodopa and protein are pretty much being absorbed at the same spot, they'd be competing if you took them at the same time, right? So that's why spacing is so important, just taking the levodopa on an empty stomach, so that when you do take the dose, you don't have to worry about the competition and you get the effects from the levodopa and you're getting good symptom management. So with the side effects of levodopa, some people do experience nausea when they first are starting on this medication. So in cases where they are experiencing that, I'd recommend, of course, something with no protein. So maybe crackers, a slice of toast, half a banana, a small piece of fruit. Generally with the nausea, it does go away after a couple weeks, maybe a few weeks or so. So that would be definitely the strategy to use there. In some cases, it may not, and of course that's a conversation to have with your neurologist, because there's definitely strategies to help manage that if that was to occur. Vomiting is a possible side effect, orthostatic hypotension, so just lightheadedness when you're standing up from a sitting or a lying down position. So of course, something like that, just getting up slow until your body adjusts to the medication. Confusion, hallucinations. Some people can experience that as well, but often I see the hallucinations might be more common with the dopamine agonist, which I'll talk about in the next webinar. And then you have motor complications, which I've broken down into, it's comprised of essentially motor fluctuations and dyskinesia. So with motor fluctuations, as Parkinson's disease progresses, our response to levodopa changes. So for people that are just starting on levodopa, for example, they find that, it's smooth, there's no issues, they don't even notice that any of their Parkinson's symptoms as well. It can last, 6 hours or so. So if they're taking a levodopa tablet, the 100/25, 3 times a day, they're finding, up until their next dose, fine, good, smooth control of their motor symptoms. But then as, years go on, after 4 to 5 years or so, just around that range, maybe a little bit, longer, they might notice that their levodopa doesn't last as long. So before, when it was lasting, 5 to 6 hours, now that they're finding that it's only lasting maybe 3, 4, 3.5, and it's almost as if it's already this dose is wearing off before their next scheduled dose, or their response to the levodopa, it feels more erratic. So what I mean by that would be, those are the changes that they might see. So it's not that consistent, smooth, long-lasting duration anymore. There's just changes in their motor symptoms. And so examples of that would be wearing off, so also known as the end of dose effect, the on-off phenomenon, dose failure, delayed on and predictable off. And I will go over which each of these means in the coming slides. So we have wearing off. So what I just said about, when you're first starting on levodopa, you find that nice long duration, but then after a few years, 4 to 5 possibly, you notice that your medications are wearing off a little bit sooner than they used to, and your motor symptom control doesn't last as long. So that is essentially what wearing off is. Like the effects of the medications are beginning to fade. And there's definitely strategies to help treat that, which I will be talking about in a couple webinars. And then we have on-off phenomenon as well, where what happens here is there's unpredictable fluctuations between PD symptoms from being well controlled. So you're going from an on state where, you're able to prep dinner, you're able to, exercise, you're able to take a walk, you're able to do the things around the house, to a point where you're poorly controlled or in an off state where it's as if, your Parkinson's symptoms are back. You're feeling a little bit more slow. You're feeling a little bit more rigid again. And these fluctuations are unpredictable. So with it being unpredictable, it's one of those things where it's not, you could have taken your dose, just half an hour to an hour ago, but then you're still getting this on and off fluctuations. So it's one of those things where they really don't know what the reason for is, but it's one of those things that may occur in some people. You have dose failure, where it's as if it's like a missed dose effect, where it's as if you didn't take anything at all. You can also get delayed on, and where this is the delay in onset of effect from the dose of levodopa. So in some cases, it's been more than 30 minutes and your levodopa hasn't kicked in yet after taking an immediate release tablet. And then you can also get unpredictable off, where it can occur anytime. You could have taken your dose, half an hour ago, 2 hours ago, and suddenly, it can happen over for a few minutes, it can happen for a couple hours where you're off. Like it's really just unpredictable. Your PD symptoms just return unexpectedly. Our next other form of motor complication would be dyskinesia. So dyskinesia, it's irregular, uncontrollable, involuntary movements. It can affect different parts of the body, and it can also spread. It can look like twisting, squirming movements, or contortions of the body. Some people experience like a wriggling, a head bobbing, or fidgeting sensation. But the main thing I always want to highlight with people, it is a side effect of some medications to use to treat PD, but it is not Parkinson's disease itself. And that dyskinesia is most commonly seen in levodopa, but it is also seen in other medications. It's just, this is the one where levodopa is tied to dyskinesia more. There are different types of dyskinesias. So we have peak dose dyskinesia, where it occurs when the levodopa levels are highest in the blood. There's also diphasic or biphasic dyskinesia, when it occurs when the levodopa levels are rising or falling, but not when they're at its peak. So people might notice they get dyskinesia, then when it's at their peak, they get improvement, but then as the levodopa levels are falling, then dyskinesia again. And then you have off-period dystonia. So dystonia is essentially involuntary muscle contractions that can result in abnormal or sustained postures. So often people might notice dystonia when their levodopa is wearing off. So it's the end of kind of the levodopa cycle. It can be shown in symptoms where your toes might feel like they're curling, or your feet and legs feel cramped. It can also, off-period dystonia can also occur, early in the morning at awakening when the levodopa levels are low. So those are some examples of dyskinesia. So this chart here, I think demonstrates or kind of shows you both the motor reflections and the dyskinesias. I'm just going to use the cursor to show, just in case for some people their monitor, the shading's not the best, but I'll try to use my arrow to show. So let me see. Okay, so down here, so underneath this dotted line, you could see that this is the inadequate symptom control, because past this threshold, when you pass the threshold, you're going to get good management of your motor symptoms, right? So early in Parkinson's disease, you can see that once you're in the middle between the two dashed lines, you're getting good symptom control. You're getting that nice, smooth, control of the motor symptoms. It's in your blood, so you can see that you're getting a good clinical response, and then you can see that can be lasting, up to like 5 to 6 hours with no problems, and you're not experiencing any dyskinesia. Whereas as go to moderate Parkinson's disease, you can see that the effects of levodopa, they don't last as long. Your curve isn't as wide, it's a little bit shorter, and you can see that the shortening, it might be, less than 4 hours, maybe between 2 and 3. And you can also see that there's a chance of increase of dyskinesia past this dotted line. And then when we go to advanced Parkinson's disease, you can see that now the effects of levodopa, even shorter in duration, possibly only 2 hours, and it's a very narrow window from good symptom management, so good symptom control in between these two lines, to dyskinesia. And in cases like this, when a lot of people might experience, or some people might experience, that when they are on, they're also going to be experiencing dyskinesia as well, because there is a very narrow window here. But of course, everyone's experience is different. But I think that these graphs just kind of demonstrate just the changes over time. So next thing with motor complications, I think the main thing I really want to highlight here is, no two individuals are the same, right, in regards to Parkinson's symptoms. Like, everyone's so different. People progress at different rates. It's one of those things where, some people will experience these motor complications, 5 to 10 years after being on levodopa. Some people, might experience certain side effects, and other people, a different set. So it's one of those things that you have to really remember, that it just differs from person to person in regards to the motor complications. So with that being said, risk factors for motor complications might be a younger age at disease onset. Some people might find that, a concern there would be maybe higher doses of levodopa can put people at risk for motor complications, higher to the disease severity, so a more severe disease as well. So in advanced Parkinson's disease, for example, just more risk of motor complications, and just longer disease duration, right? So because if it's longer disease duration, then you might be on levodopa for maybe a longer period of time, which can of course add to your risk of getting motor complications. So a big counseling point here is you want to keep your levodopa dose just as low as possible. A dose that's low, if possible, but provides you with good management of PD symptoms. With that being said, too, with the low dose, sometimes you'll need additional medications from other classes to help manage your symptoms. So it's more of a two-pronged approach, because with adjusting levodopa dosing, it might help manage your less troublesome motor complications. So what I mean by that is maybe, kind of earlier in the disease, or, approaching, after 5 years or so, you might find that, dyskinesias become an issue, like where you might feel that, oh, I might be getting this, peak dose dyskinesia. So it's one of those things where you might try to decrease your dose a little bit to see if it might help with that. But in some cases, after talking to patients with Parkinson's, they might tell me that when they did try to do that dose decrease, they experienced, they didn't hit that threshold that I showed you on the previous graph, where they didn't pass that threshold at all right here, So in some cases, you might need that additional class of medication to help with, the management of symptoms, especially for the more prominent motor complications that can occur in moderate to advanced Parkinson's. You'll need, because all the different medications from the other classes, they have their own mechanism of action, and they work together with levodopa, possibly by keeping the levodopa dose low and providing you with effective management. It might help decrease that wearing off, and it might help make the medications last longer. And then in cases where with the motor complications and just the changes in how your body responds to symptoms, in cases where oral therapy cannot manage, like the motor fluctuations, or where in cases where the medication can't manage that well, that's when we would use duodopa therapy. So in patients with advanced Parkinson's disease who experience motor fluctuations, dyskinesia, and we tried different techniques where we added maybe a dopamine agonist, we added levodopa, we added entacapone. In cases where we tried different things and it's not sufficient, someone might be started on duodopa, which is a continued infusion of levodopa carbidopa gel that is delivered to the small intestine via a tube that's inserted through the abdominal wall into the stomach. So it's just a surgical opening into the stomach too, and the tubing will just essentially feed into your small intestine to deliver the levodopa carbidopa gel. By it providing a continuous infusion, the hope is that it's going to provide you with more stable levodopa levels throughout the day. In that case, reducing your off time, increasing your on time, and hopefully decreasing the possibilities of the troublesome dyskinesias that some people may experience. So with all that being said, before your next appointment, because for some people it might be a little bit before they see their before they see their neurologist, I always tell people, see what you can do with your current levodopa regimen while you're waiting. See what you can do to optimize your management and to see if you can actually manage your Parkinson's symptoms. So in cases where someone might be experiencing delayed I ask them, are you taking your levodopa on an empty stomach? Are you taking it 30 to 60 minutes before food? In cases, if they're not, I'm like, why don't we try making that adjustment first? Another thing that we might talk about is protein intake. So for some people, they might find that they're taking medication, 30 to 60 minutes they're taking their medication 30 to 60 minutes before food. But when they do sit down and have, like, for example, their cereal with milk, they might find that, it's still affecting my symptom control. I feel like, it's taking a little bit longer to kick in. So in that case, we really have to think about what are the proteins that we are consuming when we are eating, because everyone's sensitivities are going to be different, right? So we have to start to think about our protein intake. Like if we're consuming a piece of steak, or if we're consuming something with really high protein, we might find that even if we're spacing it, it may still affect how our body responds to levodopa. So in some cases, what if instead of taking your levodopa, 60 minutes before food, you instead, you might have to increase your spacing from food. So you might have to take your levodopa maybe an hour and a half before you have anything to eat. So it's just kind of the spacing your meals around levodopa to make sure that you get the most out of your medication, if that makes sense. And then we have constipation. So what I said before at the beginning was about our gut motility, right? So as Parkinson's disease progresses, we might feel that our gut motility slows down, right? And that can affect the way our body absorbs medication. So it really, our gut motility is our whole gastrointestinal tract. So of course, what goes in with that is constipation. And obviously, in cases where if your gut motility is slowing down, then it affects, the effectiveness of the medication because your body's not absorbing it as well, and constipation can have a role in that. So it's really making sure that if you are experiencing constipation, that you're managing it, of course, through being hydrated, making sure your consumptions of fruit and veggies, and trying to do those non-drug measures first. In some cases that will work, but you might need additional, over-the-counter products to help make sure that you're regular. So it's just, if you do experience constipation and you do experience a delayed on, it's maybe one of those things that you got to make sure that you address the constipation as well, just to make sure that things are moving along in absorption, and just you're getting the most out of your medication by making sure those symptoms are being treated. So I added these slides in. It's about Mucuna Pruriens. So some people might have some questions, or they've heard about this, but essentially Mucuna Pruriens is a legume that contains levodopa. After reading some of these studies, I found that what I read was the researchers found that it may help improve symptoms of Parkinson's disease in some small studies, but these studies were also short in duration. So what that means is some of these studies were very short. I think one of them, it was only, three treatments or so over a span of like 3 weeks. It's just a single dose. It wasn't like one dose every 4 to 6 hours or so. It was just one dose. And I think another study, it was just 6 consecutive days where they got a treatment each day. So they're very short. And the small studies, it's just always a very small number of people where they found these improvements in motor symptoms. And then I found another study where it's still a small study of 14 patients, where they found that when Mucuna Pruriens was given for 8 weeks, and then they compared it to if the same individuals got levodopa carbidopa for 8 weeks, they found that the people that was on the Mucuna Pruriens, they found that about half of them had to discontinue the Mucuna Pruriens due to gastrointestinal side effects. So it might be due to nausea, for example, that they couldn't tolerate it, so they had to discontinue prematurely, or they found worsening of their motor symptoms when they were on the Mucuna Pruriens. And I think with these type of studies as well, and with natural health products, it really, it gets you thinking about certain things and things that you really have to evaluate before you take natural health products. So I think the main thing is, especially in regards to Parkinson's, is it's hard to confirm and control the amount of levodopa you receive when you take a natural source, because with these products, right, even if it says maybe, for example, 500 milligrams, are those capsules that are being formulated, are those reliable and consistent numbers? Like, are these manufacturers really confirming that the quality, and it's going to be 500 milligrams in every tablet? So with that variability, it might affect how your symptoms are being controlled, because for a lot of individuals, right, they know what their levodopa requirements are from dose to dose. They know when they have to take it. They know what dose that they need to get effective symptom management. In cases where these manufacturers are making these natural sources of levodopa, can you guarantee that you're getting the equivalent of what you would get in your oral tablet? The other thing would be impurities. So, how can you ensure these manufacturers there's nothing else besides levodopa, right? Because with any natural source, you think of different beans, different herbs, like they may be also active compounds that might play a role and might have an effect. And what if these active compounds interact with current medications that you're also, what happens if these active compounds are interacting with your current medications, right? And then adding into impurities. In some cases, for other over-the-counter medications, the impurities, what if they're toxic, right? So there's different factors you have to think about when you're taking natural sources or natural health products. Another point is the manufacturing of prescription and non-prescription medications is standardized. So whenever you're taking anything for blood pressure, diabetes, like thyroid, Parkinson's, like these medications, they go through very rigorous testing to make sure that there's safety, like there is safety and they're efficacious, right? Whereas with natural health products, through Health Canada, they're regulated through a different, I think, regulatory body, and it's different from the council essentially that make sure that they're doing the testing for prescription and non-prescription. So it's just different regulations and different criteria that they have to meet. So there is differences in just the regulations that go into natural health products and what is approved and what is not approved. And the other thing with natural sources is these natural sources like Mucuna Pruriens, it doesn't contain carbidopa or bensericide, right? So if you don't have anything preventing the metabolism of levodopa before it reaches the brain, in that case, you might get more nausea. And in that case, you might have to take more of the product to provide an effect because you would need more levodopa to get into the brain and manage Parkinson's symptoms. So there's just different things that you have to consider when you're using a natural health product. And I think this brings me to the point of, a lot of patients in the community, whether it be Parkinson's disease or something else, I just always have to tell them in regards to any natural health product, you have to think about the possible interactions. You always want to make possible interactions with like your current medication. So you just really have to talk to your pharmacist just so they can do an interaction check. With that being said, in some cases, certain natural health products, right, they might have certain ingredients or certain herb extracts that we can't find in our interaction software, so it might be challenging as well. So it's one of those things with natural health products, you just got to be really careful. So overall, my take home is that levodopa is the most effective medication to treat the motor symptoms in Parkinson's disease. But as time progresses, adjusting your levodopa dose may be required. And you just got to make sure that, if you're taking it on an empty stomach, if you have to think about its relation into other, when you're taking protein, for example, in coordination with meals, just doing those self-adjustments just to make sure that you get better management of your Parkinson's symptoms. Because, like I said, as the disease progresses, you become the expert essentially, and you will find what works for you and what doesn't work for you. And with the next one is just with the motor complications, right, that may arise in later stages of Parkinson's disease. In cases where adjusting your levodopa dose is insufficient and you're not getting that control you want, we might have to add medications from other classes. So dopamine agonists, the MAO-B inhibitors, and more, which I will be covering in my next webinar on Friday, June 12th from 2 to 3, just so you can kind of see the whole picture and how they all have their different roles. And that's pretty much it. Thank you so much for listening.